Understanding my pet's treatment. Since the first antibiotics were discovered over 100 years ago, these powerful pharmaceuticals have been used to fight bacterial infections in humans and animals all over the world. Over time, certain bacteria have become resistant to antibiotics, and although this is a natural phenomenon, it has resulted in some treatments becoming less effective. In fact, some infections can't always be dealt with. You may have heard of MRSA, that has been causing an infection problem in human health. MRSA can be found on animals as well as humans, and now dogs and cats have their own resistant bacterium, MRSP, which can occur on the skin. Antibiotic resistance, it's time to treat it seriously. It's important to avoid making the resistance problem any worse, so an increasing number of vets have a policy of only using antibiotics when necessary. In the case of skin and ear problems, this means that your pet's skin cells may be studied under a microscope, a process known as cytology, before choosing an appropriate treatment. Your vet may also carry out a culture and sensitivity test to identify the bacteria and see which antibiotic would treat them best. These investigations may result in vets prescribing a topical antimicrobial, one used on the surface of the skin such as a shampoo, gel or ear drops, and not injected or given as a tablet. When an antimicrobial is used topically, it reaches high concentrations at the site of infection and resistance development is less likely. Alternatively, an antimicrobial may not be prescribed at all, and your vet may recommend using an antiseptic. What can you do to help avoid the development of resistance? When your vet provides you with treatment, make sure you give the antibiotics or apply the topical therapy exactly as your vet tells you to. Do not skip treatments or doses of antibiotics. Make sure you give the antibiotics, apply treatment at regular intervals. Complete the full treatment course. Do not stop treatment early when your pet appears better. The actions we take now will safeguard the future effectiveness of antibiotics. The potential consequences of continued resistance development is severe. In time, common infections and minor injuries could become life-threatening. Many routine procedures will become increasingly dangerous for both humans and animals alike. It's time to change. Act responsibly.